Good afternoon, everyone. Nice to see everybody. I'm going to officially open up the Health Equity Committee for the City of Norwich. It is 2:30 on August 12th, and we're going to start off with a call to order. We'll do this through roll call. So Kate Mildy,
Present.
Patrick McCormick,
Here.
Chief Daly,
Here as well.
Melissa Myers,
Hi, everybody.
Dr. Qureshi,
Present.
Rob Scalise,
Here.
and Joe Zuzel. I am here as well. Wonderful. So thank you all for joining me. I know that the summer is a particularly challenging time. And I know that we canceled last week's meeting in order for everyone to get questions in, and I think all of that worked. I think we're looking pretty good. We're going to hear from Kate about that as well. So we've done call to order, attendance. We're doing the citizens' comments. No citizens are present. Dr. Mbiwe is just joining us. Make sure that we acknowledge Dr. Mbiwe in the roll call, please. Wonderful.
Yep, present.
Great. And I know that minutes were sent out. Does anyone have any discussion? Can I get a motion to approve minutes?
So moved.
Great.
Second.
And seconded by Melissa Myers. Any discussion, edits, changes to the minutes? You know, it's been a while. Adding someone else in here. And Dr. McLean has just joined us. It's wonderful. Okay, great. So hearing no discussions, comments of the minutes. Oops, sorry, we've got more folks coming in. Probably should have waited. I was just so eager. I had a quorum at like 2:28. All right, fantastic. So hearing no discussion, we'll do roll call for approval of minutes. I'll go back around again. So Kate Mildy,
Aye.
Melissa Myers,
Here.
Patrick McCormick,
Here.
Chief Daly,
Aye.
Dr. McLean,
Here.
Kathy Special,
Aye.
Dr. Qureshi, Dr. Mbiwe,
Present.
and Laura Dietrich.
Aye.
Joe Zuzel. Aye. Rob.
Aye.
Great. So minutes are approved. The roll call always takes so long to do that. I apologize. So updates in terms of chair updates. So I do have some interesting things to talk about in terms of health equity. So as folks know, every 3 years we embark on a community health needs assessment. This year, it's a wonderful time because we are actually working with both of our health collectives and collaboratives in the region. So that's the Health Improvement Collaborative in New London and the Eastern Connecticut Health Collaborative, which is 12 towns for Uncas and Wyndham. And so one of the things that we do is we work with Data Haven to do the community health needs assessment and collect data from the well-being survey. Unfortunately, over the last several years, our Dr. Wally's joining us. Over the last several years, we have had not a lot of luck in getting a real idea about our diverse population in terms of having their voices heard and counted in these well-being surveys. Even when we've paid for oversampling, and I know there's others of you on the call who've had this experience as well, we would still get things like not applicable listed for specific filters, topics, things that we're trying to discover. So we've worked pretty hard with the Connecticut Hospital Association this year to develop something called the C-band survey. It's the Community Benefit Asset Needs survey. And we've actually partnered with L&M in the region as well as the collaborative. So this is a regional China process, which is the first time that this has ever been done. It's pretty exciting. What we're asking is, we've actually had this survey translated into multiple languages, so Haitian Creole, Spanish, and there's an English version. It has a QR code, so you scan with your phone, We also have paper surveys that are available, but we're finding that since we've made it digital, it's much more accessible. And we're just asking that everyone really helps to push this survey out. This is directly to our community. You know, anyone can take it. It really helps. It's only 42 questions versus the 120 that the well-being survey is. You can access it on your phone or via the internet versus the landline during the workday, which was the well-being survey. So we're really trying to make changes that are culturally relevant for folks that have been left out. And it's really to elevate some of those voices. So we have till the end of August. I know many of you are on distribution channels for the survey already, and you've probably received multiple emails from multiple places, and that's great. I think more emails, more reminders for the survey. We promise we won't do that with stakeholder interviews or focus groups, but at least for this survey. So if some of you have not received that, I would really, I can send that out. I'll send it to the group again, just for everyone's awareness. This can be shared internally, externally, the folks that you serve. Not only is this wonderful for making sure that there's voices that are typically not heard from our community, but also really sort of highlighting those community benefit organizations that are having difficulties and struggling with funding, resources, what the social determinants of health landscape looks like. This will also be very impactful and helpful for them as well. So I encourage everyone to really help us spread that around. Once again, it is a community health needs assessment focused from the community for the first time. And I think that's a really big thing to celebrate. So any questions about the C-band survey or what we're trying to do with this round of the China? Okay. And I don't think I have any other updates in terms of chair updates. I can open up a little bit of extra time for agency updates if you would like. So does anyone have anything in the realm of health equity that you would like to discuss and bring up before we do report outs? Okay. So now we're going to move on to the best part of the meeting, subcommittee report outs. So when last we left our wonderful adventure here, we were getting questions together that Ms. Kate Mildy so thoughtfully volunteered to organize into a digital form of yet another survey. It's survey season. That's all we're doing these days. And the idea is that once the subcommittees had all their questions together, we would compile them in an online version. And then you would be able to distribute this survey internally to your agency for all the individuals who might be the subject matter experts to answer these questions. So for example, if I was to answer this survey and I got a number of data questions, I would send that to some of our analysts, some of the folks that I know that can pull some of the questions for this. If I got questions about human resources, send that to our HR specialists. Things that deal with the community, I'll probably answer myself, but that would be the idea. So we're going to go through each subcommittee and talk about where we are, if you've met, questions that you've developed, and we can share and talk about some of those questions. I know for some committees, I know the, direct services we've already submitted and questions were approved in this meeting. And I also know budget, equity, and legislative advocacy, they were submitted and already approved. And I know Kathy, workforce equity and workplace inclusion, we had some questions, but we were still going to look at some other ones. Am I wrong in that? Is that kind of where we left off, Kathy?
No, we submitted some back in April and then we submitted more in June.
Got it. The ones in June. Yes. I don't think we went over the most recent ones.
I don't think so.
Okay. So let's start there, if you wouldn't mind. And Kate, do you have an opportunity to share a screen or something? Because that would be very helpful for me.
I just sent you a request to be able to share.
And I am allowing that request. Perfect. So we'll start off. Kathy, do you want to report out for workforce equity and workplace inclusion? Did you guys meet since June or?
Not since we submitted these questions. We took the feedback we received from our original submission and expanded from there. But one concern we did have is there's quite a few questions here, but we don't want to go too much more than this, because if this is something that we're expecting all businesses to do, we don't want to overwhelm people. If there's too many questions, too many pieces, too many steps, we were just afraid that it would fall off. And we want to make sure this is something that's achievable.
Agree.
So there are a considerable amount of questions here, but just as we're going forward and tweaking, that was a concern.
I guess for everyone so that they can see that, can you guys see in this room here? Are you able to see?
If I lean forward, sure. Can you see it okay?
Yeah, I'm just taking notes.
Perfect.
So,
So would it be
Yeah, that's
helpful
good.
if I read the questions to individuals, did an overview? Is that helpful? All right, well, I'll start doing that, and if that gets boring, you just let me know. So has your organization cultivated representation in low-income areas to keep communication open and ongoing? What resources are free and readily available to assist job seekers, resume assistance, interview coaching, assistance finding available positions, work appropriate attire, etc.? Are job listings posted in traditional and non-traditional locations, Indeed, organization websites, so on and so forth? Are job listings posted in simple language, free of lingo and acronyms? Are job listings posted in testing provided in multiple languages? Review for any restrictions or barriers before they're posted? Educational requirements reasonable and necessary? Do they take into consideration education that might have been obtained in a different country? Options for test style if testing is necessary, written or oral testing, like that. Considering the transportation is an issue for numerous Norwich residents, is remote work a viable option? Do your organization's hiring panels have diversity, equity, and inclusion training on an ongoing basis to stay current with Norwich's demographics and the changing situations of our community members? Really like that question. How are applicants tracked through the hiring practice, particularly if the application does not include questions on race, ethnicity, gender, etc.? Are there open lines of communication between staff and management regarding work environment, microaggressions, and or inequities? Are there practices in place that track promotions, disciplinary action, transfers, etc., according to race, ethnicity, gender, etc.? I think those are good questions. Let's hear from the committee. Can we open it up? What do you think first glance? Reflecting on your own organization, are these going to be questions you're going to be able to answer?
Yeah, and there's some similarities to some of the questions in our section.
Nice.
So I think there's good alignment there.
Great. Appreciate that. Others?
I would suggest these two are very similar. This one, the simple language and the multiple languages. If we're worried about a number of questions, I don't know, maybe we merge these somehow?
Okay. I was thinking about that too. A lot of the yes, no questions, if they fall in a similar one, we could just add commas and make them just one question. Other ideas?
One of the topics is workplace inclusion, right?
Mhm.
So are there, I didn't see like any questions about opportunities for employees to contribute to organizational decision-making such as committees, surveys, etc. Did I miss that?
I know that there was something in there about, yeah, that diversity one, but that I think that's hiring.
Yeah, I thought it was all more about employment
Mhm.
practices as opposed to like ongoing day-to-day business.
Track promotion.
Culture, I guess, is what I'm trying to get to.
But
Day
like
to day.
almost as like a psychological safety and a belonging sort of
Yeah,
idea.
exactly.
Like,
Because
do you feel like you're psychologically safe to be able to make decisions for your organization and add to those kinds of things? I like
well,
that.
and have the opportunity to be included, like in committees, or other ways, work groups, social gatherings. Like there's other ways to be included in your organization's culture. So it doesn't have to be the way I'm wording it. I was just thinking about something outside of employment practices.
Yeah, I
Like some, or hiring practices, I guess. Something more culture wise.
you got an idea for that?
No, I agree. I like that probing into the cultural kind of outside experiences outside the workplace. I like that. when we get to our questions, we have something that does address that
Okay,
a little bit that might be helpful, but I do agree with Melissa's comment.
perfect.
Yeah, on the cultural aspects.
Okay, so we'll look to put like one or two into that. I'm also wondering, in inclusion, and I don't, if this goes into HR, just let me know, because I know sometimes we kind of like skip into each other's committees a little bit. What about diversity at like a leadership level? Is that a
Mm.
question for inclusion, right? So do you feel
Sure.
like your leadership, represents a diverse background or has, you know, diversity in your higher up leadership?
Sure, if we think that, if the larger group thinks that we ought to probe and isolate on leadership as well, as opposed to, does a more general question, does your employee population adequately reflect
The
the
demographics.
community's diversity, something like that.
Okay.
But it doesn't hurt to isolate and break out with at least one question
Okay.
on leadership, sure.
How do you feel about that, Kathy? Those two suggestions?
I think the first one about the inclusion is a separate question than the hiring, because I do think the hiring
Yeah.
piece really should be, the hiring panel should be up to speed and with the demographics of their area, have the training. But so make that a separate question of the culture, and are they included in probably like deciding what happens with social events and staff training and that sort of stuff. They should have a say in that. And
Or
then,
at least the opportunity.
right. And then I think it's a valid question to say, do you feel like your leadership and staff represent the diversity of the community?
Okay.
I think that's a fair question.
Okay.
Because it's leadership and staff, it's everybody.
Yep.
And that's a tricky one to get, though. I'll speak, specifically from the library. For some reason, the library field does not attract a very diverse community. We're doing well. Fortunately, we do have a pretty diverse staff, but as far as leadership, that takes time. And so currently, it doesn't.
Yeah. I think if we all look in the mirror, we're all in that sort of boat in some ways. So
But it gives us something to aspire to.
I agree. Any other committee members have comments on questions from workforce equity or workplace inclusion? Great. I like this. I'm glad that we're able to talk about this as a group and add suggestions. So, so hearing no other questions or comments, then we'll solidify these as questions submitted. Kate and I can work on the language a little bit on those two questions. We know what we're going to get at in terms of those edits. We'll send them out to the members of Dr. Qureshi, Laura Dietrich, and Kathy Special for you to take a look at the final on those questions. And then if you're okay with it, then we'll lock and load and say that those guys are done.
Joe, can I
Thank
ask
you.
just one question?
Sure.
It's so the question about the languages,
Mhm.
I'm trying to find it in the, you could just scroll. Asking if you, yeah, our job listings posted in multiple languages.
Yeah.
Should it be more related to our job postings, placed in advertising where people of multiple backgrounds or a diverse population may see it? I mean, the language piece of it, I assume that the people we're hiring, the expectation is they're either, you know, they're bilingual, not necessarily for most positions. Their only language wouldn't be in that other language. So I'm wondering if are we posting in the right places type
I
of thing?
think
as
the
opposed
question
to-
before that one has to deal with that. It's called traditional and non-traditional locations, the one right above it.
And I don't know the answer to that as far as testing. Is there an expectation you would test in another language other than English? Probably only for certain positions, I would think.
Yeah, I mean, I think it's another thing too, where we're sort of just getting this information so we can write the report. So as we get some of this information, we may find that, you know, it's not necessarily relevant to go into the report. But I think it's interesting to see how that is, and maybe that poses us to look and see what best practices are. You know, would you say, you know, that you would in your previous experiences, were you posting things in multiple languages?
No, not in my previous experiences.
Yeah.
In know, multiple HR positions.
People may see there or read the question and assume, should I be doing that? Is that something that is standard practice? And if it's not, then I don't know if it's an appropriate question. It just,
Right, yeah, that's a good point.
Yeah, I was thinking the same, that listing those four specific, well, besides English, listing those, oh yeah, 4 other languages makes it almost seem like peer pressure or an expectation that those are the 4 others you should be.
Mhm.
And I know why we say those, but I'm just wondering if we could just say other than English, which could be anything.
Yeah, I mean, I think the edit that Kate just did on the board where it says our job listings posted and testing provided in multiple languages and then simple language free of lingo.
Yeah.
acronyms.
Okay.
And then I think like the one right below our job listings posted in traditional and non-traditional locations, Patrick, I think that's where we're talking about, are we just not posting it on Indeed? Or are we putting it in other places as well? Because not everybody's on Indeed, right? Not everybody has access.
right. Yeah, I think
Good.
I appreciate
That's
it.
I should tell you, currently, we are going way beyond just Indeed at the city website.
Yeah.
Yeah, way beyond.
That's awesome.
Yeah.
Cool. Anything else on workforce or workforce equity or workplace inclusion? All right, moving right along. So data collection and dissemination. So Dr. McCormick, Dr. Walia, Patrick McCormick, Dr.
No
Walia.
doctorate.
I gave you a doctorate.
Thank you, though. I
That's
appreciate that.
wonderful. Yeah,
I was gonna say, no, he works for a
just
living.
handing them out. I'm just handing them out today. That's how I am. So I don't know, Dr. McLean, if you want to lead us off, tell us, what you guys have been up to. We'll look at the question.
Sure. Thank you. Dr. Walia, Patrick and I have been going back and forth. And thank you, Joe, for taking some of our raw data and kind of helping synthesize it with the right lens. And so here is kind of the ones that we submitted in terms of organizational and analytics. How does your organization evaluate responses? How the opportunity's been created for community input in different kind of formats. How does your organization evaluate its capacity to consult with other organizations kind of doing the same kind of work? What steps does your organization take to analyze patient outcomes data? Scroll down a little further. About 6 questions there. And then how's the current structure of benefits and for employees been assessed? So it's kind of focusing on the employees of the organization, and then how do we evaluate customer service? And then from there, we wanted to make sure that we had, with the other questions being asked, that we covered a few other things. And this is where Patrick had given us some great input. Do you even have a community needs assessment? How often do you do it? What's the most recent year of your plan? Do you use, what kind of data do you use? If you don't do your own data, what do you use for assessment? So I was waiting to see if any of those questions were injected elsewhere. I can kind of put that list up in the air too, but that was we were looking to see if there was any more detail on the other questions. And then finally, when you get down to asking about what kind of data at the single patient level, we wanted to make sure that the basic, insecurities were covered: food, housing, access to transportation, utility bill, exposure to violence, and medical care. We had a bunch of detailed, questions that might be asked, but we wanted to not get that granular if this is more of a organizational survey. So that's the kind of body of work that we've been doing, and happy to take any input or see where any of the gaps may be, where some of these questions could help the survey.
So see a comment in the chat here. Missy has an idea. Perhaps consider how our patient complaints received, tracked, addressed, and aggregate data distributed, or consumer complaints.
Yep.
I think that's good.
I like that.
So one of the things that we're talking about these days, especially with working with the collaboratives, is when we ask individuals for their input and we're getting information from the community, how are we sharing that information with those individuals, right? So it's one thing to collect the data, but then how are we also closing the loop? So I think a question about that would also be helpful too. how are we being transparent with, our data collection and our results, right? So I know with community health needs assessment, most of you who are, all of you who are doing them, most of you do them on the phone, on the committee here. We share that publicly. That's what we do. But also, what about our other data, right? Other data that we collect. Is that something that we can share? If we can share, how do we? Or if we can't share it, I think that's also important to write up too, that these laws prohibit us from sharing this kind of information. That's good information for the community to know as well.
Great.
If you would just send us those recent ones that you were reading off of, you would send those to Kate, so incorporate them into here. I'll open it up now. Anyone have questions about data collection and dissemination? Any questions for the committee? Adds, changes? Okay. So I think you're right on track with saying we want to try to keep it at that organizational level. I mean, with data, we can get so in the weeds that I think it would bog everything down. We want to make sure that we're just attacking it from a space where it's high level, like, hey, are we doing these few things? Internally, if an organization says, well, since we've done that, we want to go a little bit deeper, great. But I don't think it's our standpoint to write every variable about data. I think that's just going to get a little cumbersome. I don't know how everyone else feels about that. Okay. So, Dr. McLean, if you just send those questions, we will finalize data collection questions, and that's all set. We did direct community services already, right? Does anyone want a refresher on that? Are we good? Community needs, interventions, diverse populations, operational changes, implement programs. How do we determine what kind of things we want to put out into the community? What's the percentage of people who are working quality jobs? What does your organization do to increase the accessibility to meetings, events, opportunities for diverse populations and people with disabilities? Okay. All right, we'll keep on moving down the road here. So impactful learning and professional development. So we have Chief Daly, Dr. Walia, and Rob on this one. Rob, do you want to steer this?
Sure, I'd be happy to. The three of us met twice since our last larger committee meeting of the whole in June. We have come up with the following questions. I could detect some overlap right away, a couple of the prior committees reporting. Have you heard of diversity, equity, and inclusion, DEI? And if so, what does it mean to your organization? I think it's interpreted differently. So we thought that question was important. What does it mean to you, your organization? What would you like your organization to learn about DEI and belonging? Does your organization represent diverse backgrounds and identities? And then the follow-up, if so, do you believe that your organization hires diverse candidates that are fairly representative of your community? Do you work in an organization where all voices are heard and valued, regardless of their background or identity? Do you believe that you would be taken seriously in the workplace if you reported issues of DEI? Do you believe that your personal characteristics, such as your race, age, sexual orientation, or gender, are a barrier to your career progression? Do you feel uncomfortable or unsafe in the workplace due to your identity? Does your organization provide either mandatory or voluntary DEI training? And then have you personally participated in DEI training? outside of formal training, does your organization provide opportunities to learn about diverse cultural experiences in the workplace? Which I think is somewhat similar to at least one of the other committee's questions. Is there a clear procedure at your workplace for reporting and addressing discrimination or bias? And then the last one, we thought, well, let's get outside the workplace with a question. Do you believe that DEI is also important outside of the workplace? For instance, at home, at school, or in the community?
I'm gonna open it up. Questions? Comments?
I feel like some of these definitely have similar content, like you mentioned, to the other ones. So
Agreed.
I've been looking at this too much to go through and figure out, highlight where the overlaps might be, but I think that would be something good for a fresh set of eyes to look at the whole survey and at least highlight where we might be able to merge some questions.
That will be definitely next steps, is to scrub through these questions to see, which ones are duplicate, which ones step. I really love the subject of all of these questions, but I feel like whereas data was focused at an organizational level, this one is much more focused at an individual level. So I think we might tweak these a little bit to make it more of an organizational standpoint. So for example, have you, so if you scroll up here you go. Does your organization provide either mandatory trainings or voluntary training? It would say like, what trainings does your organization provide, either mandatory or training, right?
Okay.
Because in that way, what we'll do is we'll sort of set best practices for that. And then all of our organizations, we can figure out, okay, well, this one's mandatory for us, but this one's voluntary for you. So how do we get a line on that? So do you feel comfortable or unsafe in the workplace due to your identity? What does your organization do to ensure that individuals feel safe in their workplace based on their identity? So we did the same thing with budget equity and legislative advocacy. We just flipped to the audience, basically.
Okay,
Are people comfortable with that change, or is that committee comfortable with that change if we just do that from?
I'll let the doctor and the chief provide their input. I'm okay with it, but
I am too, if you're trying to get to an organizational level. I do think it is interesting to get people's take on it at the personal level, but it probably would cloud the rest of your data.
Yeah, makes sense. And this might be something that just these questions, that if people wanted to do a follow-up, these are questions that could go into that organization under impactful learning and professional development. So HR folks could even use it as a tool in the version that it is now. Dr. Wally, how do you feel about that, changing the voice? You're on mute right now. You're muted.
I'm talking away as I usually do. And I said, oh, these are like my kids, don't listen to me. Anyway, yeah. What I was saying is when the three of us met a couple of times, we were kind of confused who the audience was for this a little bit. And that's why we went with with the data we had that we built this questionnaire out of. So I'm okay. I mean, if we are asking an organization, it's directed towards the organization, not an individual in that organization.
Yeah.
But I had a follow-up question on that. So the survey will go out to organizations. Do we expect one person in that organization to answer these questions? Or are they going to distribute it out to the relevant individuals within their organization?
So the second part, so as representatives from our own organizations, it's up to us to be able to say, okay, please fill out these questions, this aspect, so on and so forth. You can copy and paste the questions, and then whatever their answers are, you can fill it out yourself. However, that you're comfortable doing that. There might be one individual that knows all the answers to this. But I mentioned earlier, for example, HR questions, I'm not going to be able to answer that on my own, so I'm going to have to send that to my representative. I can do the community. Other questions, comments, changes to any of the questions from impactful learning, professional development?
I'm
will-
gonna just take this if so one out because we hit it on another question.
Okay.
Low
Perfect.
hanging fruit.
Yep.
Okay.
I have a question about all questions in general. So we
Sure.
are, just so I understand this correctly, we're promoting this for all businesses, not just healthcare field, right?
So we're gonna send it to all of our organizations. So this is the committee's organization. So
Okay.
for Modus
So-
Library, we'll hear from Modus Library, we'll hear from the police force, we'll hear from UCFS, Hartford Healthcare. And then based on all of our answers, we will compile that into a document that says, this is our current state. This is our best practices of what we're doing now. I'm sure there will be some reflection as committee members to say, hey, I didn't realize this was going on. Maybe we should make some changes. Maybe we should do this. But that's the health equity report we'll submit to the city of Norwich to say, as the health equity committee members, this is what we're currently working on. This is what we're doing. And then it's up to them how they want to share that information and what they want to do with that.
Okay, so along those lines, just for consistency, I think we should remove references to patients.
Agree.
Because we don't always have patients.
Agree. Yeah, I saw that too. People served, individuals served.
Right.
That will be the next task that I will embark on, is sort of editing this up a bit. Any other questions about the questions or anything about impactful learning, professional development? I like that there's training information on here. I like that there's some psychological safety stuff that Missy was talking about, but more from that impactful learning side of things. So I think you guys did a great job with the subject matter of this. All right. Hearing no other questions or comments, I think we're locked in for that. And then budget equity and legislative advocacy, we've already have those questions submitted and those were previously approved. So currently where we sit now is we will clean up this survey document with all the finalized questions. We'll send it out so that you can all approve it and take a look at it, catch and see if there's any issues that need to be addressed. And then once we're okay with that, then we will discuss how we're going to disseminate this. We'll put together a little plan so everybody's doing it the same way. And then we'll set up a timeline for when we'd like to receive the responses back. Once we get the responses back, then we start to compile and put that all into a report that we would then submit. And that would be our final project, so to speak. Right? So once that's done, we decide in the city where they want this whole committee and this whole initiative to go. Because we will be finishing our goal, which is creating that health equity. Questions about that process, ideas? Okay.
So we'll all see the whole packet before it is presented, though.
Correct. Yes, we're gonna make sure everybody sees it before we say, here it is for dissemination. And then it's up to you how you put it out within your own organization. So we're not gonna be sending it out to other organizations. You'll have the questions, you'll know where to get that information. And we can go over a couple of different ways of doing that, whether it's emailing or, calling folks or talking to folks or interviewing folks, whatever you need to do. All right. Do we have any other business? Anything anyone wants to discuss otherwise? This is going to be a impactful, quick, good meeting here. All right, so hearing no other business, I just want to thank everyone again for working so hard to put these questions together and meeting. I know that this is all volunteer opportunity for us. This is added things to do, and summer is a really difficult time. So I really appreciate people putting in the time and the effort and helping us get this together. Can I entertain a motion for adjournment?
So moved.
A second, please.
There
Second,
you go.
Okay, so Kate and Dr. Qureshi. We will do a roll call. Kate Mildy,
Aye.
Patrick McCormick,
Aye.
Dr. McLean,
I suppose so.
Kathy Special,
Aye.
Dr. Walia,
Aye.
Chief Daly,
I,
Dr. Koreshi,
Aye.
Dr. Mbiwe,
Aye.
Laura Dietrich,
Aye.
Joe Zell, aye. Rob Scalise.
Aye.
Great, we are adjourned. Thank you so much. Have a